Welcome, my friends, to the Bob and Brad podcast. My name is Mike Kienitz, and today I'm interviewing Dr. Deb Riczo, who is a physical therapist. We are going to be talking about SI joint pain and dysfunction, how it's diagnosed, what it looks like, and treatment options for it. So without further ado, here is Dr. Deb. So what is the recommended treatment for SI pain?
Okay, so it really, there is in the literature not one particular recommended treatment. It's basically whatever journal you're reading, whatever practitioner you're reading will have their own treatments. And the research has been very difficult to compare because they're not using the same, what they call as outcome tools. So if you go to an orthopedic surgeon, if you go to a chiropractor, if you go to a surgeon, if you go to a pain management doctor, if you go to a physical therapist or a general doctor, you're going to get different treatments. And I hear this all the time because, like I had mentioned, I do coaching and people will come to me and they have been through, it's not uncommon to have been through 3-5 years of going through revolving doors trying to get help. So it really just depends. The research does say that exercise and education are very important. The physical therapy research, the physical therapy literature regarding pregnancy does say that exercise and support belts are helpful. Manual therapy is mixed. There's not strong evidence that you should have manual therapy. And that's really what chiropractors do. That's what a lot of therapists do. That is what I had done early on in my practice because that was the thinking. Because we're trying to put things back after they've gone out. But we now know that they're not really out. So does that mean manual therapy can't help if there's a lot of soft tissue tightness and you can't help relax the muscles? No, the literature is mixed on that. It also says that for postpartum, that they would also benefit from the exercise and the education as far as, like, for example, body mechanics. So if you are always doing something the wrong way that's causing and feeding into the problem, you can do all the exercises you want. But if you're always carrying, for example, your child on the same hip all the time, then that's feeding into the problem. So we need to address education as well. So the method in my books, like I said, we've already talked about this, but it's called the pelvic girdle musculoskeletal method. And it is based on what we talked about, all the different layers of the muscles, and that they need to be working in a coordinated way, and that it uses our breath and the rhythm of our breathing and connecting our mind, being mindful, and causing a total relaxation of our bodies so that we can get the movement we want. There's a lot of research done on pain, and there's a big connection between fear of movement and lack of improvement. Because if you're fearful of movement, then that causes your system to be like on guard and your muscles aren't going to relax. So that's why in my method, there's a lot with the coordinated breathing patterns with the exercises.
So is there anything else someone can do?
So there is a lot. So we already talked about the remedial. If we start on the top left of the screen, the remedial exercises that I talked about, balancing the pelvis, deep core exercises, also stretching and strengthening the muscles, because the muscles are what hold our skeleton together. And if we can try to improve that, then we'll be able to move better. You want to engage your core during your day-to-day activities. If we move over to the left on the top of the screen, aerobic exercises and balance exercises are important. And of course, you have to do all of this within your tolerances, within your capability. We just have to do baby steps and take steps at a time. If we go down below, is there anything else I can do? You want to avoid one-sided activities. Like I mentioned, carrying the toddler on one hip, carrying the briefcase or the purse, or laying on one side in bed, always laying on the same side. Working at your computer and having it off to an angle and always turning and always leaning to the same side. There's a lot of things that we do that are one-sided activities that we may not even realize, but if we start thinking about it, we can figure that out. Moving over to the right, stress reduction in general is huge. We all have stress in our lives. I think that's part of living in today's world. How we manage, and stress is not bad in and of itself, but how we manage that stress and can make a big difference, because stress causes an increase in hormones that rev up our fight or flight system that causes our muscles to get tight, which is what, I talked about earlier. And this, even if you have had a bad day, if someone just touches your upper neck muscles, you just might feel, not even notice, but then you realize how tight they are. Some people don't store their tension in their neck. They may store it in their belly. They may store it in their throat. They may store it in their pelvic floor. So getting rid of stress, like if there's one big thing that is a stress thing and you can do something about it and you are having a lot of pain, I would definitely, advocate for that. Breath awareness, moving over, is huge. Breath awareness is part of any type of meditation, yoga, Reiki, any kind of relaxation therapies that you can think of. Breath awareness is critical, and it's because it will actually, research shows that the deep breathing affects the stress. It affects the tone in our vagal nerve, which causes a whole relaxation thing. So there's tons and tons out there about breath awareness and breathing. Avoid ruminating, moving over to the left. Ruminating, some people may not know what that word is. I didn't until I started doing this work.
Yeah, what? Ruminating. I know what a ruminating animal is, but what's ruminating?
So there you go. So don't feel bad if you don't know what that is. Ruminating is when you replay the same story in your head over and over again of something that was a bad thing that happened, and you can't do anything about it, but you just keep on playing it over and over in your head. And it's just not helpful, and it's not helpful to your inner body and your inner system. So that is, and we could ruminate about anything. We all do it. We all do it. It's not like we don't all do it, but some people do it more and are more really highly skilled at ruminating. And so if you're one of those people, look it up and try to if there's something that's in your past and you can't change it, thinking about it, just like say, no, I'm not thinking about it. When you find yourself thinking about it, or choose just one time a day, like maybe in the morning or something, or at noon, that you're going to think about it, and then do not let yourself think about it the rest of the day. So anyway, that's just one tip. Healthy eating habits, 8 to 10 glasses of water or fluid per day. It doesn't have to be water. You just want to make sure that you're hydrated. Healthy eating habits, there's a ton out there. I think you guys know what that means. What is healthy eating habits, right? So that's really important, because if you're having pain, you want to nourish your body so it has all the right stuff to work on the inflammation, work on getting you to feel better. You'll feel better if you eat healthier. And people may not believe that if you don't tend to have healthy eating habits. But if you give it some time,
Yeah, it's very true.
You'll feel better.
Yeah.
I guarantee it. I'm actually a vegetarian. I didn't always used to be a vegetarian, but in my mid 40s, I turned over to, I switched to being a vegetarian. I do eat fish, and I have never looked back. It just one day I just stopped, and yeah, I feel great.
Yeah. A lot of it's just getting processed food out of your diet.
Processed food, absolutely, absolutely. Healthy sleeping habits, that's another big one. A lot of people struggle with sleep, and there's help out there. There's sleep studies that can be done to see if there's any problems that can be helped medically. But often it is could even just be that you're ruminating and you can't turn your mind off at night, things like that. So healthy sleep habits, again, there's a lot of information out there about sleep. And healthy body weight, of course. If you have a healthy body weight, it's going to just make things a lot easier for you. And of course, there's an awful lot on that. And to seek professional help in the areas that you know you need help in. And so that is things that you can do that are aside from the direct things that you would think of going to the doctor. Right now, it's a psychosocial. What I'm talking about today is called a biopsychosocial model of care. And that means that it's bio, so we are looking at, our muscles and our joints and everything that's happening inside of our body from an anatomy's perspective and how it all works, because that's important. That's the bio. The psychosocial part is what we've just been talking about. Our mind, our control of our thoughts, how our thoughts turn into feelings, how that affects our hormonal system, our judgments, what we do, and our beliefs. There is a lot written and researched about our beliefs. You could have the most wonderful therapy in the entire world, and you may not get better if you do not believe that you will get better. And that's hard to believe, actually, but it is true. They've done a lot of research, and that keeps cropping back up. Your beliefs. Also, if you're satisfied at your job. Now, who would think that would have a play or a role in what your outcome is going to be? But that has been proven time and time again. How happy you are at your job and your belief whether you're going to get better or not will affect your outcome. So there is a lot we can do. And so if any of this is resonating with you, knowledge is power, and we need to act on that knowledge in order to make use of it. So in summary, we just talked about I think I already summarized it, so I'm not going to beat a dead horse. But I have social media on Instagram and Facebook at Rizzo Health Education, LinkedIn at Deborah Rizzo, and Twitter at Deb Riczo PT.